Hi guys, I'm Ragishri. I recently cleared my AMC MCQ exam. I'm here to share my AMC journey. And today I'm going to talk about what is the AMC standard pathway and what exams you have to give and what is the approximate time that's going to, take to get you into the general registration to, pursue your PG training in Australia. So the AMC standard pathway. The standard pathway is for those candidates who have finished their MBBS in their home country and they want to practice as a doctor in Australia, or they want to pursue their further training, the postgraduate training in Australia. It is for those candidates. So what is the standard pathway? In standard pathway, you have to give your AMC MCQ exam, AMC clinical exam, and you have to clear the language requirements. And if not, you don't want to give the AMC clinical, you can enter into the WBA program. So we'll look into it. What exactly are those? So the topics, okay, what is the AMC standard pathway? We discussed that. And we actually, any doctor who is an IMG, who wants to practice in Australia, has to get a general registration to enter into the training program. So what registrations are there? What is a general registration? We'll get into that. What are the language requirements and what is exactly the supervised practice? And what are the pass rates of the AMC exams for the standard pathway? So what are the registrations? There are three types of registrations: the limited, provisional, and the general registration. So when you give your AMC MCQ exam and your clinical exam, you become eligible for the provisional registration, where you have to clear your language requirements also. When you give all these three exams shown here, you will be eligible for your provisional registration when you land into a job, where you have to apply. When you get a job offer, you have to apply to the APRA. So the APRA will grant you your provisional registration. And with the registration, when you complete 47 weeks of your supervised practice, which is basically working as a junior doctor or an RMO in Australia, you get to apply to your general registration. And then from here, you can apply into a training program. But you don't want to give your AMC clinical exam and you just want to bypass the pathway and you want to give your WBA. What is that? So when you give your AMC MCQ exam and your English exam, you become eligible for your limited registration. So with the limited registration and when you get into a job, you have to finish your 47 weeks of supervised practice also. In between of your supervised practice, like when you finish your 6th month of your working as a junior doctor, you can enter into a WBA program where you can put your interest that I want to go into a WBA program, and they will take your interest. And then when the vacancy opens, they will, take you into the program. Till then, you just have to be in the waiting list. Right now, the waiting list for the WBA is 6 months to 2 years. So you just have to put your interest and then wait until you get your chance. So minimum you need a 6 months of working experience in Australia to enter into a WBA, and the hospital you're working should also be a hospital where you can enter into the WBA program. Not all hospitals in Australia are into the WBA program. A lot of hospitals just consider the clinical. So only a little number of, like around 25 hospitals in Australia, can grant you the WBA program. So around 6 months of practice and 10 months of WBA. Minimum of 16 months is it gonna be to get into your general registration. So 16 months to 24 months is the minimal time where you have to put in work for the WBA program to get the general registration. But if you go through the AMC clinical exam and then if you clear that, then it's just going to be 1 year until you work in Australia and then get the general registration, and then where you can enter into the training program. Okay, what are the language requirements for the English exam? For you have to clear basically any one of these exams to be eligible for the registrations mentioned above with the APRA. APRA is the Australian Health Practice Regulation Agency. So IELTS you have to score greater than 7. TOEFL is minimum of 94. OET B grade in each of those categories. PTE academic is overall score of 65. Okay, what is the supervised practice? So supervised practice is where you have to complete your 47 weeks of rotational training, where you have to rotate in multiple departments. This is basically the junior doctor or RMO job where you'll be paid with respect to the other doctors working also. So at least you have to work in 10 weeks in medicine, 10 weeks in surgery, 8 weeks in emergency medicine, and these make up to 28 weeks. So the other number of weeks left out in the 47, you have to you can choose your own things, where you have to talk with your HR in your hospital, and you have to choose those rotations which are going to help you, enter into the training program, or you want to explore these departments further, so you can do rotations in those departments. Okay, now we are going to discuss in the pass rates of the exams. What is the pass rate for the AMC MCQ exam? So the total number of graduates who actually gave in the year 21-22 is 2,696, and in the year 22-23 is 4,468. So you can see the total passed number is 1250 in 21-22 year and 2,119 in 22-23. So the total pass rate is 46% in the year 21-22 and 47% in the year 22-23, which is around 50%, and which is very good compared to the AMC clinical. So the AMC MCQ is very, very doable compared to the clinical, but it needs a right preparation also. So what is the AMC clinical? What is the pass rate for the AMC clinical? So the pass rate is, the number of students appeared is 1787 in the year 21-22 and 2053 in the year 22-23. So the number of people passed is 381 and then 426. So the total pass rate is 21% in the respective years, and which is very, very low compared to the AMC MCQ. It's not even half as the AMC MCQ. So this is a very tough exam, but you can do it with proper preparation and all. So, and one more thing regarding AMC exams is you can write them any number of times. There is no limit for the number of attempts. So you can attempt 4-5 times until you clear the MCQ, and then the clinical also. But it is difficult to find slots for the clinical exam, which run out in 2 to 3 minutes when they start releasing. So that is what you have to be a little bit careful about. And the WBA. The WBA, you can see the statistics. The pass rate is more than 95%. There are just 2 to 3 candidates who, didn't clear the WBA in their respective years. So, but the number of positions in the whole country for the WBA is very low. 156 in the year 21-22 and 209 in the year 22-23. So, which is very, very low. So there is a long waiting period for such low number of positions for the WBA. So it will take a lot of time. But if you get into a WBA and if you can clear it, that is really, really great, and that is going to be the best thing happen, because getting into a job and then into a WBA, it's very hard. So that is going to be the best thing. So it's very good. The WBA, the pass rate is also very high, and if you put in your efforts, it's going to be easy, because it's going to be in the hospital where you're working. So it is easy. Okay, there are also 2 other pathways, the specialist pathway and the short-term training pathway, which are for the people who finished their MBBS and their training also in their home country. And I'm not sure exactly about the requirements of the pathways, but you can look forward for them. And I'm from the standard pathway, so I cannot comment on them, but these are the terms, so you can, search for them. So this is the, the brief thing about the AMC standard pathway. So thank you guys. Please like, share, and subscribe. And I'm also going to post my AMC MCQ journey and also my AMC clinical and the upcoming exams, the journey of my AMC pathway basically. So thank you for watching.